case presentation, treatment plan acceptance. These can be some of the most confusing things in dentistry, but why should they be? I mean, after all, a patient comes to us for our expertise. We do a great examination and diagnosis, and we let them know how we can get them healthier. And then they say no, or they say, let me think about it, or let me talk to my spouse, or whatever excuse to put things off. And then most of the time they never get it done. Why is this? This makes no sense. They're coming to us to get healthy, but a lot of times they say no to our suggestions. Well, there are two, not just one, but two obvious secrets to case presentation / treatment plan acceptance. And that's what I'm going to be talking about in today's episode of the Dental Practice Fixers podcast. I am Dr. Richard Madow. I'm your host today, and I'm co-founder of the Madow Center for Dental Practice Success. So get ready. We should have some fun today. And of course, we're going to do a couple mystery shopper calls towards the end. So I'm looking forward to that. And we're going to be talking about treatment planning and what I call obvious secrets. So let's get right down to it. But first, real quickly, another obvious secret is you are probably overpaying for your credit card processing unless you're using Stacks. So what the heck are you waiting for? Your processor charges a percentage every time somebody pays with a credit card. Stacks charges a low, fixed monthly fee that does not change. Translation, you will save tons of money just like we do at the Madow Center. We certainly use Stacks there. Why not? We love lowering our overhead. So you should too. Go to madow.com/save, madow.com/SAVE to find out how much you can save every month with Stacks. And then you'll thank me. You don't have to, but that would be nice if you did, like so many other people have. I mean, seriously, we have hundreds, if not thousands of dentists across the country using Stacks based on our recommendations. So join in the fun, save some money. It's simple, and it's on autopilot. Okay. So a couple of weeks ago, we presented a webinar at the Madow Center. I was the presenter. It was called Foolproof Case Acceptance in Your Practice. Your practice, not anyone else's. Who cares what other people are doing when they talk about their case acceptance? Because I got news for you. I used to be in one of those local study clubs. Everybody's exaggerating or lying, whatever, when they talk about their case acceptance percentage. And people don't even know. I mean, unless you're really meticulous about entering all of your data and then knowing how to interpret it, you don't even know what your case acceptance percentage is. But I can tell you one thing. Everybody thinks it's higher than it actually is. Kind of like when you want to sell your car and you say, "Oh, my car is worth $12,000," and the internet says it's worth $12,000. Well, guess what? The internet's not buying your car. So that's one of the funniest lines ever. I had this patient. This was kind of when the internet was first becoming ubiquitous. And he was a used car guy. He bought and sold used cars for a living. Really nice guy. And he said the internet really changed everything because people will come up to him, and he would have to, he would make cash offers for people's cars. And then, of course, he would have to turn around and sell them for a profit. So people would come to him and he would offer whatever, $7,500. And they would say, but my car's worth $9,500. I just saw that on the internet. And he would say, well, then sell it to the internet. I think you know what I mean here. Because no matter what you see online, or no matter what you hear at your local study club, it doesn't matter unless it's actually taking place in the nitty-gritty of someone's dental practice. And I got to tell you, most people's case acceptance percentage is much lower than it should be. So again, I did this webinar. It was really well received. It was an hour long. Obviously, I'm not going to repeat the entire webinar on this podcast. But one thing I talked about on the webinar that seemed to really get a lot of attention and people really liked were the two obvious secrets to treatment plan acceptance. Now, the obvious secret is the name of probably my favorite dental book of all time. It was written by Dr. Earl Estep way back when in 1972. I was in ninth grade, I think, in 1972. Many of you weren't even close to being born yet in 1972. So yeah, it was a long time ago. After I finished my residency, I think my first associateship, 1985 or so, the owner dentist handed me a copy of The Obvious Secret, and it was already old and it was already outdated. And Dr. Earl Estep, the author, was talking about amalgams and all this stuff that even in 85 seemed a little like that. And he was giving his fees. It was like $4 for an extraction. I don't remember exactly, but I mean, I'm just reading this thinking, I'm like the young hotshot residency trained, super cool dentist. This stuff couldn't possibly apply to me. And many of the things didn't. But when it came down to it, it was a book about human nature. And Dr. Estep, probably one of the greatest dentists that I've ever known or read, or seen lecture when it comes to understanding the psychology of patients and how to work with human nature to get them to do all the things that we want them to do. And as I've said a million times, purely ethical, because generally speaking, the things that we want patients to do are the things that are best for their health. Of course, we want them to come in for regular visits. We want them to accept their treatment. We want them to refer others. Well, that's good for the health of our practice, but hey, that's good for their health too. So all these things are good things. And Dr. Estep studied human nature, and in the book, he goes through all these different aspects of human nature and how to work with human nature instead of against human nature. But he found that even knowing all these things and even putting them into practice, that his patients weren't as good as he would have liked. They weren't cooperating, so to speak. They weren't accepting treatment as much as he would like, until he came up with what he calls the obvious secret. And Dr. Estep's obvious secret was, when people are stressed, they stop learning. And, it makes so much sense. Nobody likes to be stressed, and we do stop learning. And, it's stressful enough for a patient to come to the dental office. Let's face it, usually they don't want to be there. They don't like getting their teeth cleaned and scraped, as they might say. They certainly don't like injections. And then, that horrible sound of the handpiece. It's not a pleasant experience for many people. So people are stressed already, even when they open the door of your dental practice. And then we use these old school case presentation techniques of just throwing a whole treatment plan in front of a patient. Remember why they came in. Usually a new patient comes in, they chip the filling, they're having some pain, they're overdue for a cleaning, whatever. It's not typically someone that says, I know I need a ton of work done and I'm ready, doc. That happens every now and then. And when it does, it's great. But that, unfortunately, I guess, is not typical. Usually it's for one small reason. And then these fancy pants treatment plan, case acceptance courses suggest that we stress the patient out by throwing this whole shopping list of needs in front of them and saying yes or no, asking them for a yes or no answer right then and there at their first or second appointment. It's not working with human nature, and it stresses the patient out completely, and then they stop learning, or we might want to say they stop, they just stop listening, and they're not ready for what you have to say, and it's just easier for them to be scared and run off screaming, no, 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 no. So one of the things I talked about in this webinar is how to present treatment in steps while still being ethical and giving the patient the big picture of their needs, but doing it in a way that doesn't scare them off. And as I said, I don't have time during this podcast to do the whole webinar, but I think it's still up on our website at no charge. It's called Foolproof Case Acceptance in Your Practice. So if you want to check it out, that would be great. You can just go to Madow.com/webinars. Matter.com/webinars. Make sure you do the plural, because if you just put in webinar, that won't work. You'll probably go to some 404 not found, which, what does 404 mean anyway? Why when you go to a page that doesn't exist, it says 404? I never understood that. But go to Matter.com/webinars. It was actually only supposed to be up there for a week, but I'm going to ask Sylvia to keep it up there for a few more weeks so our Dental Practice Fixers podcast listeners can take advantage of that. So again, Matter.com/webinars. It's the one called Foolproof Case Acceptance in Your Practice. But what's the second obvious secret? Well, I made the second obvious secret. I love Dr. Earl Estep's obvious secret so much, I decided I'm going to have Dr. Rich Maddow's obvious secret when it comes to case presentation. And I think this one's even more important. Sorry, Earl, if you're listening down there in Athens, Texas. I guess you're not a young guy at this point, but maybe you're listening. Who knows? I think you're long out of clinical dentistry, or dentistry in any way. I think his son might own a lab. I'm not sure. Anyway, my obvious secret, Dr. Rich's obvious secret, is it's not about the patient saying yes to the treatment. It's about the patient saying yes to the practice. So think about that for a second. I'll repeat it again, just for fun. It's not about the patient saying yes to the treatment. It's about the patient saying yes to the practice. And all we focus on, did the patient say yes to the treatment? Did they say yes to the scaling and root planing? Did they say yes to the implants? Did they say yes to the $20,000 comprehensive treatment plan? Did they say yes, 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 yes? But that's not what it's about. It's about the patient saying yes to your practice, which means you've got to do a gazillion things right. All the little things that I've talked about over the last 30 years, things like night calls, calling the patient a night after treatment, new patient thank you notes, handwritten in the doctor's sloppy handwriting, taking patients back on time, being really properly greeted when they enter the practice, especially as a new patient. And I can go on and on and on and on and on and on, making sure they're incredibly numb, giving the most pain-free injection on the face of the earth, is speaking in plain English instead of dental lingo. Again, I could talk about 100 of these things, but it's case acceptance is not about case acceptance, if that makes any sense. It's about practice acceptance because every patient's different. They all have different needs, different financial barriers, different timetables, comfort levels, all these things. And that's why when we try to push a lot of treatment on a patient at once, their negative antennas go up and they're more prone to say no. But if we focus on getting this patient to love our practice, getting this patient to know they are going to get clinically excellent dentistry here, getting the patient to know that we care about them as a person, we know about them, and that we'll do everything we can to make them comfortable, then they are going to say yes to their treatment, maybe not right away. Some patients, might take a month to get their treatment done, 2 months, 3 months, 3 years, it doesn't matter. What we're worried about is that when they do finally get it done, and they won't all get it done, but when they do finally get it done, they get it done in our office and not somewhere else because we didn't scare them off, or we didn't work with human nature, or we didn't do 1,000 things right so they know that they're in the greatest dental practice in your vicinity. So I hope that makes sense. Remember, my obvious secret, Dr. Richard's obvious secret is it's not about the patient saying yes to the treatment. It's about the patient saying yes to the practice. Because if they say yes to the practice, the treatment will come. But if they say no to the treatment, they will leave your practice. It's that simple. It's that obvious. That's why it's an obvious secret. Okay. Well, hey, I hope you enjoyed that. And again, if you want to hear more and learn step by step my treatment planning technique that I use to grow my practice from a bankrupt mess into an extremely successful practice, again, it's free. We don't even ask you to register. Just go to madow.com/webinars, WEBINARS, and you can watch this. I think we might have a few other webinars up there as well. So, hey, have fun. Do it during a team meeting. Do it while you're at the gym, on the treadmill. I don't care when you do it. Just do it, please. You will not regret it. And then send me a line to let me know what you think. Rich, R-I-C-H, @madow.com. Rich@madow.com. Send me a line about anything, especially if you want to discuss what's going on in your practice. If you are a practice owner and you want to talk about your practice, issues you're having with your team, your patients, your success, your income, your production, your collections, whatever it is, I'll set aside some time for you. So again, just email Rich, R-I-C-H, @madow.com. We can hop on the phone. We can hop on a Zoom. I'd love to speak with you. So let's do it. All right. Now we're going to move on to our mystery shopper calls. Woo, these are always so much fun. I love these. So every now and then on the mystery shopper calls, I just kind of go back to basics. And the basic thing is, I want to be a new patient in your practice. How much is a cleaning? We might call it an irritating question, a dumb question. I don't care what you call it. I'll call it those things too. But this is how many potential new patients make their entree into your dental practice. So you better believe that you need to be able to answer this question and answer it well to get the patient off the phone and into the appointment book. So I did 2 of them, 2 right in a row. Let's go over here to Command Central and check them out. I said out for our Canadian friends. Check them out. If I can find them. Command Central is being a little persnickety today. Okay. Yeah, I've never been to your office before, and I want to know how much is a cleaning appointment?
Well, just the cleaning, if it's just a regular standard cleaning, is $110.
Okay, got it. 110. And I saw on your website too. You do bonding. What is that like for teeth to make their smile look better, kind of thing?
Well, bonding is fillings, so we use the white composite material for fillings. So if you had a cavity and you needed a filling, that's considered bonding.
Bonding. Okay. Got it. Got it. Well, thank you so much.
You're welcome. Bye-bye.
Okay. Bye. Wow, she was really, really pleasant. I mean, I could just feel her smile and her positive energy. Unfortunately, she completely botched that call. Woo. Now, I'm a big stickler about this. If you're going to have something on your website, you better know what it means, because people will look at your website and they will ask you questions. I love simple websites. I don't think you need a ton of information about different dental procedures. Certainly, I think you need to get the patient interested in your practice, great doctor bios, photos, testimonials, an easy place where they can contact you or make an appointment online, the call to action, so to speak. But when you start mucking it up with all this other stuff, in my opinion, it leads patients away from what they were there to do, which was to learn a little bit about your office and make an appointment. That it's not a dental resource library for the public. But if you choose to go that route and you've got stuff on your website, your team better know what it is. So I went on this doctor's website and they had a big thing about bonding. Now bonding, of course, that's a very vague term. Technically to us, it does mean when one material bonds to a tooth or to another material. But in the context of this website, it certainly meant cosmetic bonding. What we would think of as maybe in-office hand-formed veneer, whatever you want to call it. Cosmetic bonding, you would use it to close a diastema, make a misshapen tooth look a little better, whatever the reason. You all know what I'm talking about. So on this website, in big letters, they talked about bonding, and it meant cosmetic bonding. Then I called this practice, and she thought it meant doing a bonded restoration, like a filling, as she said. So that would be, just say, a bonded MO composite on a premolar. That's not what this patient wanted to know about. And then when the call first started, how much is a cleaning? 110. I mean, come on. Is that just for the cleaning? Does that include the exam, the radiographs? Are they trying to bait and switch me? Not intentionally, but when I get there and learn that I've got to do the exam and radiographs, am I going to be PO'd? This is why these questions can be real no-wins. So again, let's get the patient in. Let's do what it takes to do. I love free consults, as you know, but let's get the patient in. I don't like necessarily insurance questions. I think sometimes it's just a bad way to start a call. But if a patient asks, how much is a cleaning? I think it will be totally appropriate to ask about their insurance status, because the question might be, oh, I'm so glad to hear you've got that fantastic insurance. Your cleaning will be no charge. Woo! Music to most people's ears. So not great. And of course, she made absolutely, and I mean absolutely, zero attempt to make an appointment. Let's go to another one.
Hello? Yeah, hi.
Is this the dental office?
This is, yes.
Oh, yeah, good. I drove by, I saw your office, and I wanted to find out about getting a cleaning, but I have a question for you. I went on your website, and then the first thing I saw was this big thing that said Skin Medica. But is this a dental office?
Yes, it's a dental office. He does Botox too, so that's why we do, we have that on there too.
Okay. So what is Skin Medica Botox?
No, it's a product. It's a facial product that they sell, that the same brand that we get the Botox from sells.
Okay. But you do regular cleanings and fillings and stuff like that, right?
Oh yeah. Yep.
Mm-hmm. And how much is a cleaning?
Well, do you have dental insurance?
I don't.
Okay. Yeah, I can tell you how much. Have you been to another office in the last year?
Probably about a year.
Okay. And then do you know, were they doing like the regular cleanings, or do you know if you had like a periodontal maintenance cleaning?
I don't know. It seemed like just a regular cleaning to me.
Okay. So for just the exam and the cleaning, if it's just a regular cleaning, would be $220, $294.
Mm-hmm.
That doesn't include X-rays.
Okay, so I can maybe, if I have x-rays, I can maybe get those to you?
Yeah, if you have so the bite wing X-rays, those are good for a year.
Mm-hmm.
And the panoramic or the full mouth set of X-rays are good for 5 years. So if
Good.
you have either of those in that time range, yeah, you can have them sent over.
Okay, good. Well, thank you so much.
Yeah, you're welcome.
Okay, bye.
Bye.
Whoa, doggy. Okay, first of all, she answers the phone. Hello? Yeah, hi. This is a professional dental office. Is that how you answer the phone at your office? Hello? Yeah, hi. That was pretty uncool. I love the fee for an exam and cleaning, $222.94, 94 cents. I don't understand where this comes from. $222.94, but whatever. Who cares? That's just a weird point I wanted to make. But the reason I asked about that Skin Medica thing is because today, just for fun, because I wanted to talk about websites. Before I made each of these two calls, I pulled up the practice's websites. And when I pulled up this practice's website, on the home page, the first thing you see is this huge banner that says Skin Medica. What the heck is that? Well, I just can't imagine that that's what you want to put on your most valuable piece of website real estate, on your homepage, and this huge banner, Skin Medica. I mean, it's like some kind of Fakakta lotion they're selling. It could be multi-level marketing. I don't know what it is, but it's hard to believe that that is what this dental office wants most patients to know immediately about their office, that they sell some overpriced skincare line. That made absolutely no sense. And she didn't even seem to be that sure of what it was. So that was a big, big, big failure right there. Again, asking about the cleaning, pretty typical. She did it, go to insurance, which I guess we could say was acceptable. But again, absolutely zero attempt to make the appointment. What are we going to do here? We are not going to stop until every single practice in the US and Canada and all over the world listens to the Dental Practice Fixers and gets this right, which I think means we'll be doing this podcast forever. So, hey, check it out. Hey, send me an email, Rich, R-I-C-H @Madow.com, if you want to chat about your practice or about anything else. I'm here for you. Go to Madow.com/webinars, plural. You can check out the webinar we just did called Foolproof Case Acceptance in Your Practice. And of course, if you want to save money every single month by not paying a percentage on your credit card processing fees, just a low monthly fee, go to Madow.com/save. All right, right on. I'm Dr. Richard Madow, co-founder of the Madow Center for Dental Practice Success. And this is the Dental Practice Fixers. I'll talk to you soon. Bye.